इसमें उतना सुनिए ना मैंने नो सके अच्छे मैं सोई कर से
सर एक बार जब लाइव हो जाए तो कंफर्म कर देंगे क्योंकि मैं बाकी
Okay,
पार्टिसिपेंट
sir.
को ओके
Sir, we are live now.
चलो
ओके वी आर लाइव नाउ ठीक है ठीक
हां ये जूम शुरू की
है श्योर डॉक्टर साहब बस के ज़मीन बकर सारी इन्फॉर्म रजिस्ट्रेशन लाइव की है तमिश कर बाकी यम पार्टिसिपेंट वन की लाइव
अच्छा ठीक है चलो
ओके हाँ डॉक्टर साहब बस ये 2 मिनट में हम कर रहे हैं स्टार्ट ठीक है सर
ठीक है
ओके
मैं डॉक्टर साहब
डॉक्टर साहब का सर
करे बस आज पार्टिसिपेंट इंश्योर यार बेचारे भी कुछ
ना ये चाहिए ना पार्टिसिपेंट है कि ये
अच्छा
इशू है बता सकते हैं
ओके
कौन से लिंक पर ज्वाइन करूँ
अच्छा मैं लिंक पे हूं
बस
चेक करे बस
ये ओके सर We are going to start now our webinar. Uh, good Let us introduce myself first. My name is Bilal Ahmed Butt, and I am working as an area business manager from last 20 years in Kerala Pharmaceuticals. And today webinar is just going to start. Uh, it is basically our new launch, not new launch, but basically we have just 1 year before we have launched the product by the brand name Thrabies. It's a anti-rabies vaccine, and the differences between just our speaker will elaborate. I will just give a brief introduction of this product. This is anti-rabies vaccines. Previously, we are, as you know, we use using this 5 dose regime. Instead of 5 dose regime, we are just cut down the dosage. What we are getting in the 5 dose regime results, we are just getting the results of just in 3 dose with Thrives. So just as a 1 week therapy compared to the 5 dose regime that was about 24 days. So this is a small introduction of our product, and let us invite our honorable speaker, Dr. Abdul Hamid, who is a ARV in charge in SMHS Hospital, Government Medical College, Srinagar. He will further discuss about this product and gives you the brief introduction and medical of the this very brand. And on behalf of Kerala Pharmaceuticals and my team, I welcome our speaker, Mr. Abdul Hamid, and I am thankful to all the participants who are just participating in this event. Thank you very much. Over to Dr. Abdul Hamid.
Hello.
Hello.
You're
audio. You are audible, sir. You are audible.
Good afternoon to everyone who is just watching this webinar. I am myself Dr. Abdul Hamid. I am a medical officer in the anti-rabies clinic at SMH Hospital. So I'm just sharing my screen. स्क्रीन शेयर हो रही है? हेलो?
जी सर, अभी नहीं हो रही है.
जस्ट स्क्रीन शेयर. ओके, स्क्रीन अब हो रही है?
Not no.
Now it is visible, sir.
It is visible, sir. It is visible.
Okay, thank you. So today's webinar is about the dosage and administration of the new rabies vaccine, the Thrives, which is manufactured by Kerala. Will be just the content, so we'll be discussing about the rabies disease and worldwide incidence in India, its epidemiology, and the various stages and various vaccines which have been developed till date, and what the challenges we face nowadays in administering the rabies vaccine. We'll be giving a brief introduction of the rabies and its technology and some of the evidence-based clinical studies. As all of you know, we know that rabies is an RNA vaccine. Which is a causative agent of fatal disease called as rabies. Rabies is transmitted through the bite of animal, particularly dog. More than 90% of the patients of rabies have a history of bitten or contact with a rabid dog. It's found all over the world except some countries. In India, it's also endemic disease except in Andaman, Nicobar, and Lakshadweep Islands. As caused by the rabies virus, it has this virus has about 5 proteins. We have G, N, P, L, and RNA. We'll discuss the indigeneity of each in the next slides. G protein and N protein are the most potent in
Hello.
Bilal ji, is there any network issue out there? Bilal ji, am I audible to you? Bilal ji, you're on mute. Can you please unmute and speak?
Yes, it is. Basically, I was talking to doctor. He is in the hospital. There is some network issue. He's just logging with mobile only.
Okay.
Within a couple of minutes, he will join.
Sorry for the technical issue. Am I audible now?
Yes, you are audible, sir. You are audible, sir.
Some issues with the electricity here.
Mhm.
Okay. So in India, it's endemic, except in Andaman and Nicobar Islands. And most pollutant states are, we have seen Uttar Pradesh, then Chhattisgarh, Odisha, Andhra Pradesh, and all. Rabies is 100% fatal. One who gets infected with the rabies virus, there is no treatment yet. But same times it is 100% preventable if you follow a good post-exposure prophylaxis. And like we have the local wound care and we have the vaccination available. There have been different stages of this development of vaccine against rabies. It was first the Louis Pasteur who developed the first vaccine against this rabies, but that was a nervous tissue vaccine. Therefore, the development of vaccines, the development has considered by four major stages. Number first is the neural tissue vaccine, the non-neural tissue vaccine. We have then cell culture vaccine, and we had recombinant DNA and this vaccine. But once this first neural tube vaccine was developed, it has some side effects. Adverse events following injection were more, and there has been some deaths reported after using this neural tube vaccine, and more number of visits to get this vaccination. I remember the 14 injection days when a patient used to get 14 injections on abdomen, that on daily basis. That was very painful, and we used to have a lot of side effects and adverse events following immunization. Then the age of cell culture vaccines came. Usually today we use cell culture vaccines, and then DNA recombinant vaccines, they were found to be less immunogenic in humans. So currently we use rabies vaccines, which are cell culture vaccines. And if you compare to the previous vaccines, as I have discussed that, because they are not used now because of their stability issue, because of their supply issue, and because of their adverse events following immunization issues. If you compare in some states, not in Kashmir, if you talk about the Kashmir, there is a good complaints of these 4 injection sites, because we are providing free of cost in the government hospitals. If you talk about the other states or all over the globe, the complaints of 4 injection site or 5 injection site is less as compared to 3 injection sites. Reasons may be because of the non-availability of vaccine, because of the fear of injections, because of the non-accessibility of the vaccination centers and all that. So keeping in view this, this unmet needs of medical need, because it's a 100% fatal disease and we need to get fully vaccinated. We need to get the patient fully vaccinated. Then there is an introduction of novel vaccine. with simple and short regimes, which is called as, which is the Thrives vaccine, which is manufactured by the Cadila manufacturers. So what is peculiar about this vaccine? That is the first protein subunit vaccine. As I have said that it is based on the G protein technology, and is the G and N proteins are the major immunogenistic proteins which produce immunity in the human beings. It is prepared by the virus, like protein technology. It's the first vaccine in the world with the 3-dose intramuscular regime, that is 0, 3, and 7. Currently, we use the modified Thai regime of 3 to 4 doses. We use 3, 0, 3, and 0, 3, 7, and 14. If you get intradermal, but if you get intramuscular, we use 0, 3, 7, 14, and 28 days. That means intramuscular regime currently, other than Thrives, we have to get vaccination for the 5 times, 0, 3, 7, 14, and 28 days. But because of Thrives vaccine, there is only 3 sittings, 0, 3, and 7. So it's a ready to use vaccine. There is no need to reconstruct the vaccine with the adjuvants which are provided with, and it's less painful as compared to the other vaccines. This vaccine is developed based on the technology which is called as the G protein technology or VLP technology. Is the firstly manufactured by the Cadila manufacturing units. VLP is a virus-like proteins, and they are similar to the native virus particles, but they do not contain the virus genome. They cannot replicate, but they can mimic the viral indigeneity without being pathogenic. Because here I want to avoid while using this gene protein technology, they don't use the RNA, which has a chance of replication in the body. But this technology, the chance of replication in the body and produce a rabies-like disease is very, very minimal or not possible. So there has some evidence, research-based evidence, like we have a paper, they have a paper published that original research article, a novel recombinant rabies G protein vaccine, VLP-based rabies vaccine. This has been published in the journal of, official journal of this, official journal of Association of Prevention and Control of Rabies in India. It has been published, and the results are like this. You can. They have taken 22 to 5 patients with 5 arms. This was a trial. They have just divided these patients into 50, 50, 50, 50, and 25. In the first arm, that's 50 patients. They have just introduced 10 micrograms to one arm, where they have introduced 2 doses at 0 and at 3. Second arm may be 50 microgram दिए है, the same duration, same sting, 0 and 3. उस थर्ड आर्म में उन्होंने क्या किया है कि 10 माइक्रोग्राम्स दिए हैं 0, 3 and 7, जो भी हमारा रिकमेंडेड है, और फिफ्थ में दिया है 50 माइक्रोग्राम्स 0, 3, 7, and they have used in a conventional this control vaccine. They are given it at 0, 3, 14, and 28 days. If we see the results of this trial, here we can say at day 14, the seroconversion was 100%, 100% seroprotection by using all 5 arms, whether use 10 micrograms at 0, 3, or 7, or 50 micrograms of 0, 3, or 0, 3, 7, or a controlled vaccine. So at day 14, the seroconversion was same, that's 100%. Same was the results at day 42. Same was the results at 90. So 90 days पे हमारा 100% conversion सब vaccine में था. But if you compare this first 10 micrograms at 0.3, the seroconversion at day 180 was about 80 to 90%. That is not 100%. And this 10 micrograms at 0.37. This means this arm. 10 micrograms the both arms. The seroconversion at 180 was diminished. It was 90%, but it was 100% in the control and other 2 arms. If you compare these results at day 270, only 50 micrograms of this rabies, which was given at 0, 3, and 7 shows almost 100%, more than 90%. Rest of the 4 arms were not having as much F0 conversion as the 50 microgram dose at 0, 3, and 7. And the clinical trial, safety and immunogenicity of novel 3-dose recombinant non-particle rabies G protein vaccine administered as a simulated post-expiratory prophylaxis. It was a randomized, comparator-controlled, multicentric phase 3 5-dose regime was administered. The total participants were 800. Out of 800, 533 were giving administered this vaccine rabies, and others were administered connection failure. Others were administered the reference vaccine. So as per the WHO, this trial, the primary objective was to demonstrate the non-inferiority of the test vaccine on day 14 after the first dose related to the reference vaccine in terms of the seroprotection rates. The seroprotection rate, which was discussed, threshold which was to be this reference said that it should be more than 0.5 international units per ml, and it was calculated at day 14. Subjects with the seroprotection at day 14 days post first dose should be or equal to 0.5 international units per ml. The second objective was that subjects with the seroprotection at day 14 post first dose of test vaccine okay. So these were the results. As far as the efficacy was concerned, efficacy was about 99% in rabies and 97.2% in the reference vaccine at day 14. And at day 42, it was 100% in the reference vaccine and only 98.69% of the reference vaccine. But the p-value were not significant in this case. If we talk about the safety of overall safety is in rabies it is 99%, and in Rabipur it's the adverse events were more seen in the reference vaccine. That is 17.2% of the adverse events were seen in the reference vaccine, and only 9.9% of the adverse events were seen in the this rabies vaccine. And if you divide it in the local and the systemic events, local maybe we have less events in rabies as compared to the reference vaccines, and systemic maybe we have less events for this in the rabies vaccine, except some urticaria and all that. Overall, if you see that the adverse events, the safety is more in the rabies vaccine as compared to the reference vaccine. Rabies was non-inferior to the reference vaccine. Less adverse effects compared to the reference vaccine, and novel 3-dose rabies was found to be safe and immunogenic and was comparable to the 5-dose WHO pre-qualified vaccine. So it has got some awards, like they have got some Pharma Innovation of the Year by the Economic Times, and it was awarded as the Golden Globe Tiger Award, Malaysia, for Innovative Product of the Year. And as per there's a program, it's called the NAPRI, National Action Plan for Rabies Elimination, Dog-Mediated Rabies Elimination. The target is that there should be 0 deaths by 2030 in India. And there's a slogan that 1, 2, 3 rabies free. And they have just concentrated, they have just focused about this this vaccine 0, 3, and 7 intramuscular regime of therapies. There are slogans that 1, 2, 3 rabies free. So this is the NAPRI initiative. I think it's all about any.
Thank you very much, sir. Thank you very much, Dr. Saab. It was just program was very nicely, and you delivered very nicely, and all about our rabies, our anti-rabies vaccine. Now I am requesting the audience, the other doctors, participant doctors, if they have any query or question, they can freely ask to Dr. Saab question in the just with the link given. So Dr. Saab will try to solve and answer all the queries.
Hello, doctor. Myself Siddharth, and I'm from the marketing team of the Cadila Pharmaceuticals. Beside, I was listening to your session, and it was very informative. Thank you so much for your kind words. And actually, some few questions actually raising in my mind. I just want to ask some of it. So, if a dog, there's a case study, like if a dog is get bitten by a pet dog, so is it necessary to take the anti-rabies vaccine? Because
If
it
a,
is
dog,
making-
if a person is gets what's your question? If a person
is get bitten by a pet dog.
exactly, yes, yes, I got it. If a person gets is vaccinated by a pet dog, we should go for the vaccination. 100% we should go for it. Number one is that we are not sure about the vaccination done. We are not sure about the documentation done. And number three is most important that we have some mutations here. You have seen in Kerala there is a number one coverage of anti-rabies vaccines, but still there have been some deaths recently. But they are thinking about this mutagenicity of this rabbit virus. As I have said, that is 100% fatal. We should not take any risk regarding the administration of vaccine. So I recommend that if a person is getting bitten by an animal, dog, cat, or whatever who has been vaccinated, go for the vaccination. Go for the vaccination as per the category and go for the full vaccination.
Thank you so much, doctor. Doctor, my second question, is there any time period, like just like if the person is getting like a tetanus vaccine, तो उनमें बोलते हैं कि 2 महीने के अगर बीच में कि अगर आपको किसी आयरन से कांटेक्ट में आते हो तो भी आपको चल जाता है, तो ऐसा कुछ है कि इसमें टाइम पीरियड में एंटी रेबीज वैक्सीन
वो दैट्स वो तो आपका रेबीज से कुछ उसका देयर इज नो कनेक्शन अबाउट रेबीज, देयर इज अ प्रोफिलैक्सिस फॉर टेटनस. तो हाउ योर जजमेंट, हाउ योर बॉन्ड विल आस्क यू इस हिसाब से कितना जख्म है, वो हिसाब से आपका टेटनस प्रोफिलैक्सिस, दैट इज समथिंग एल्स. Along with the rabies, because it's a bite, the skin has been exposed. So we usually take the history. If it's vaccinated recently for tetanus, there is no need of this getting tetanus. But still, this depends upon the category. So if 5 years तक कोई, if it's scratch minor, तो tetanus नहीं है. But if category third हमारे पास आता है and severely bleeding, if 5 years तक तो मेरे ख्याल से नहीं देना चाहिए. बट स्टिल इट डिपेंड्स अपॉन द जजमेंट ऑफ द क्लिनिशियन जो आपके पास वो आपका ट्रीट कर रहा है. बिकॉज़ इट्स डिफरेंट एंडेड. वी गिव टेटनस नॉट फॉर द रैबीज, वी गिव टेटनस फॉर द प्रोफिलैक्सिस ऑफ द टेटनस. That's a different situation.
Okay, thank you, doctor. Doctor, my last question is like what if the person is vaccinated by a 5 dose, he's actually going with this vaccination 5 dose regimen, can he just shift to the rabies 3 dose? If it is possible, is there any possibility if the person is actually getting vaccinated of is the continuous vaccination is going on, 5 dose regimen process is already going on?
If he has received, your question is if he has received all the 5 doses of vaccine, of reference vaccine, so if he has received 5 doses, there is no need to get 3. If he is getting repeated, he has again an exposure. If he has exposure for the in between the 3 months, bite ke baad 3 months, so there is no need to get vaccination. If he gets bitten by after 6 months, we can do on the booster dose. And if it's more than 10, you can restore the schedule as de novo.
Okay.
But if he is getting, he has taken 2 doses or 3 doses of particular vaccine, so recommendation है कि वो वही vaccine continue कर. For example, he has taken 2 doses of reference vaccine. He is not advised to recommend that he should take 3rd dose of rabies vaccine or other types of vaccines. We have here available. We have serum available. We have mono. That's a different story. बट रिकमेंडेशन है कि जो भी आपने वैक्सीन लिया है, सेकंड डोज या थर्ड डोज है, कंटिन्यू विद दैट टाइप ऑफ वैक्सीन एट दैट पर्टिकुलर सिटिंग, जो भी आपका पोस्ट शेड्यूल आपका है. तो if you are getting a exposure after say 6 months or 1 month or 1 year or 2 years, then there is no issue that you can switch to the vaccine. But एक stick में, एक PEP stick में you have to do use only one vaccine.
Thank you so much, doctor.
Thank you very much, sir. On behalf of Cadila Pharmaceuticals and my team, I am very thankful to each one of you participant because of your busy schedules. You got your time from your busy schedules and accept our invitations. We are very thankful to all of you. And special thanks for our speaker, Dr. Abdul Hamid. I know his busy schedules, and I know he got some trouble during the session because of light electricity problem. I know all of these things. So thank you very much. Thank you very much.
Okay.
Yes. Before starting the session, I was just discussing the doctor. Yeah, you are connecting this webinar from home or office. Though he just tell me, no, I'm going to just from my office only. So you are waiting. You just spare your time for us. We are very thankful to you, sir. Thank you very much, sir.
Thank
It
you.
was a very lovely, and very nice webinar. Thank you very much, sir.
Thank you so much, doctor.
Thanks,
Thank you.
Siddharth. Oh, okay. Thanks, Siddharth. Okay.
Also.